Hello, my name is Dr. Stephen Mulholland, President and founder of Spa Medica. I've been serving the Toronto market with cosmetic plastic surgery and medical spa services for over 25 years. One of the most common surgical procedures I performed over that 2.5 decades is breast augment surgery, over 2,000 breast augments. What is a breast augment? A breast augment or augmentation mammoplasty is the use of an artificial device that's inserted through a small incision into the right pocket to create projection and volume, a natural projection and volume that provides a lifetime of contour, shape, and balance. There are different types of breast augment surgery, typically divided into the type of implant that is used. A saltwater or saline implant, not very common anymore because they tend to leak, they tend not to feel too natural, they can leave ripples. And the newer generation of gummy bear cohesive gel implants that have been around now for about 18 years. In the past 10 years, we have a beautiful form, stable, smooth shell gummy bear implant that's warranted for life. The implants have a very smooth shell to them, almost like an intravenous bag, a smooth, silastic shell. The inside is made up of gel, and this is form stable, meaning that it's responsive to your position. When you lie down, it's round. When you stand up, it becomes teardropped. This gel implant is warranted for life. It comes in many, many different sizes, and you work with your surgeon like me to decide which implant is going to best achieve your needs. Some of the best candidates for breast augmentation include women that are dissatisfied with their breast projection, volume, and shape. That can be because of hereditary and developmental issues, like you were just born with small breasts that don't balance your hips and your shoulders. You can also have an acquired or developmental loss of breast volume, massive weight loss, weight gain, or pregnancy with lactation or breastfeeding can lead to a deflation and loss of volume. And so those are the most common causes, and then candidates would be those women that have thought about the alternatives, have decided that breast augmentation with a cohesive gel breast implant is the solution that they want to pursue. They're medically well, they don't have any contraindications, and they've thought about the recovery. Those are the best breast augment candidates. How do you decide what kind of implant, what size of implant would look best for you? Well, I've invested over the past 10 years and believe strongly in 3D imaging technology, almost like deciding what kind of nose job would look best on your face. You need to get in front of a Vector 3D imaging device to decide, together with me, your surgeon, what implant's going to look best for you, what's going to best balance your breast waist hip ratio, your shoulders and your hips. And there are many implants that might look good for you, and you need to work through that in front of a 3D imager. When you press a button, there is the look of that size and shape. And you go through a number of different sizes until you refine and hone down the specific kind of implant that's best for you. It's kind of like going into a Holt Renfrew and trying on a shirt and being disappointed that it didn't fit properly. You thought it would look good, but it didn't. Same with breast implant surgery. You want to try before you buy. So the best candidates are going to be those patients then that have a 3D imaging, a sense of what they want to achieve, and then you should not be disappointed in the size and the shape that you selected. There are some alternatives to augmentation mammoplasty using a breast implant. We can increase the size of your breast form and projection by the use of fat grafting, taking fat from where you don't want it, purifying it, spinning it down, and injecting it into the breast. And fat grafting for breast augmentation is very popular. You get a modest improvement. It's not nearly as predictable nor as large volume as you can achieve with breast implants, but it is still a very natural option for many women. And so fat grafting to the breast remains the number 2 option for augmenting projection, shape, and volume of your breast and figure. What are the operative considerations of undergoing a breast implant surgery? Well, you need to decide 3 fundamental elements. First is, what size implant and what consistency? Well, no one chooses saline really much anymore, so it's going to be cohesive gel, round, smooth. And you got to choose the height, the projection, and the volume. And your surgeon, you're going to work with me to decide which looks best for you. I'm going to give you some options: small, nice, medium, nice, big, nice, and then you're going to do the imaging machine to decide which one you want. So once you pick your implant, the next thing we need to decide is the incision. With cohesive gel implants, we really can't stuff them through a small armpit incision or through a belly button around the areola. So the incision of choice over the past decade has become under the breast or an inframammary crease incision. The next question is the pocket. Do we go under the muscle or on top of your muscle? When I say muscle, your pec major muscle. The most natural plane is going to be under your breast gland and on top of the muscle. However, if you're very, very thin, you could see the round edges of the implant. And in those circumstances, we advocate going under the muscle. So implant, incision, and pocket. Once you have those figured out and planned, you're a good candidate. If you're medically well, you've considered this, and you're healthy, then we can do the surgery. Recovery from breast implant surgery is typically fairly quick. The operation takes under 2 hours. Typically you can go home about 2 hours later. The recovery leaves you with some swelling, some bruising in the chest area and the breast area. You have a small incision, typically 3 to 4 centimeters, under the breast, hidden by the crease. All the sutures are dissolving. We don't often use drains, and they're swollen. And so you should take approximately 1 week off work. After a few days, you can start doing massage on your breast. We show you the exercises we want to do, and typically they drop and soften into place by about 3 weeks. They look quite good at 3 weeks. You can be back to work after a week if you have a fairly sedentary job. By 6 weeks, the implants look very nice, and by 3 months, they become very bouncy, soft, and very natural. How long do breast implants last? Well, the biggest companies out there, Johnson & Johnson, Allergan, they warranty the integrity of your implant for the rest of your life. If it fractures, they'll replace it. If your implants harden, if it hardens around your implants, your tissue hardens and you get a capsular contracture, they will contribute and help in the cost of removing that capsular contracture and putting a new implant in. And so there's a lot of confidence you can have around the support around your breast implants and around your breast implant surgery. Thousands of women have chosen Spa Medica for their breast implant surgery because of our reputation, our experience, our 3D imaging, and our appreciation and artistry of truly what creates a beautiful female shape and form, the integration of shoulder, breast, waist, hip ratios in your ultimate outcome. Over the past 25 years, I've done many television shows designed to help educate and inform women about breast implant surgery. So let's take a look at some of those.
I just want to make my whole body look proportioned, fill up the breast area.
In the market for breast implants, how new technology can help you decide before you invest in your chest.
Awarded Best Newscast, the News Hour with Leslie Roberts and Ann Ruskowski.
Well, just like any big investment, you want to know exactly what you're getting before you commit.
And for women looking to enhance their assets, testing out the product was not an option.
That is until now. And our Mina shows us how technology is reshaping their decisions.
You wouldn't buy a car without taking it for a test drive. How about a wedding dress straight off the rack? Most brides try on at least a few. Women will even sample red lipstick to see if it's a suitable match.
This type of round.
And yet, up until now, the try before you buy philosophy didn't apply to breast augmentation.
20% of breast augment patients that would be really happy they did it, but dissatisfied that the size doesn't quite match what they were thinking they wanted.
Carrie Tench has been contemplating getting implants. Like many moms, her breast shrunk considerably after nursing her 2 kids.
I just want to make my whole body look proportioned, fill up the breast area after having children.
But she's been apprehensive up until now, worried the results would look obvious or overdone.
Please hold for the flash.
New 3D technology gets rid of the guesswork. Women get to see the predicted results before they go under the knife. A few clicks of the button, and this machine renders Carrie's chest in 3D. She can now demo various shapes and sizes virtually.
Previous to this technology, a client would come in with magazine tear-outs to communicate the look they were after. They'd have to shove the implants into their bra or use the old rice in a stocking method. But of course, none of this would resemble the real silhouette following the procedure.
round, teardrop, silicone, saline, or mixed composition.
They have 397 different options to choose from, and that's a bewildering array. If you leave it to your patient, they could never choose that. Imagine 397 dresses in your size.
Carrie makes her selection and goes into surgery.
They're amazing.
We caught up with her 3 days post-op.
I never would have guessed.
Yeah, they look natural and real. They fill out the bra, they don't sag over the bra, the bra doesn't cut in. They really kind of look like what I remember them to look like when I was in my 20s.
And I like to emphasize we are by no means endorsing breast augmentation. For the record, Carrie does not regret for a second nursing her babies. But for women who are contemplating this kind of surgery, this 3D imaging is revolutionary.
Absolutely. And I can see that it's not just women who have lost volume because of having a baby. I mean, breasts change throughout life after
Weight
menopause.
loss, yeah.
Breast cancer. You know, these are very important elements to consider too.
Absolutely, and especially if a woman loses a breast to a mastectomy after breast cancer, you know, she wants to make sure that the implant she gets in reflects the other one, and this kind of technology could really work that way.
Yeah, it's very interesting. Thank you, Mina.
You're welcome.
Today on Cityline, it's Makeover Madness. Bill Rowley hits the ice with tips for your winter hair.
Moisturize, moisturize, moisturize. And maybe learn how to skate.
While Dino tackles chapped lips, we take a look at a post-baby tummy tuck. Plus, Dave Lackey brings us his spring beauty picks. And wait till you see these transformations. Right now on Cityline. Coming up, a mommy's tummy tuck.
All loose skin, that's courtesy of 3 or 4 children. The children are great, but they sometimes leave devastation behind them.
Yes, they do. Well, I think we've all been there. Amanda was feeling a little self-conscious about her post-pregnancy body, so Dr. Mulholland gave her a new mommy makeover. Take a look.
Have a seat and relax. So, pleasant young lady, you've had a baby now. How old is your child?
She's 3.
3 years old. Breast augmentation is extremely common. It's number 2 right after liposuction. As women nowadays are entering into their postpartum years, they've had their kids, they are healthier than they've ever been. They diet, they exercise, Pilates, yoga, but they look in the mirror and what they can't bring back is what babies and breastfeeding took away. Before you had children, you had a fuller upper pole of your breast, a little perky. You're always smallish, but you always had a perky, fuller breast.
Exactly, yeah. You're so used to having like a tight little figure to you and really not having to work too hard at it. I didn't feel as sexy, I didn't feel as desirable anymore, and that did a lot to me.
So would you agree that's the area that's been frustrating on the front?
Absolutely, yeah.
She's worked out like a fiend. She's exercised for 3 years. She's down to her ideal body weight, and she has a nice figure, but she's bothered by a little pot and some love handles around the sides. So the most important principle of lipo today is get reciprocal contraction of the skin with removal of the fat. So you have a thinner contour, but you don't make a granny tummy. You want to make a youthful tummy, which should have tight, smooth skin. For the breast, obviously if you've lost the volume, you're not going to be able to get it back. There's no magic pill of breast augmentation. But breast augment surgery's changed significantly in that you can choose a shape, either teardrop or round, and a size that fits you. And we do that through a special imaging machine called the Vectra 3D. Nowadays, the telltale signs, which are visible incisions, we give lots of options to patients. Often under the breast has turned out to be one of the best approaches. It's become a very safe operation. It usually performed in under an hour, not even under general anesthesia, light twilight sedation like having a colonoscopy or having a dental wisdom tooth extraction. It's good to see you again. How many months is it now?
It's been 4 months.
4 or 5 months. Okay, great. So are you happy?
I'm so happy.
Great.
Ecstatic. I completely refound myself, and people have noticed a change, especially in my personality, my sense of humor, my overall being has changed since having this done.
Okay, I think she hit the the nail on the head there, Amanda, at the end when she says, people have noticed the change, but you notice she said in my personality. So a lot of people will look at her and say, okay, her body was already great. Why is she getting anything done? But sometimes it's a psychological thing. It's not always a physical thing.
Yeah, she didn't have a huge change in her figure.
Yeah.
A little bit of fat reduction, skin tightening, and a small augmentation. And if you didn't know her, you would know, because she's wearing push-up underwire bras and wearing support Spanx.
Right.
But now she could wear what she wanted, tank top or an evening gown, feel sexy again. And the biggest change was in her perspective, in her perception, and how she carried herself.
Right, okay. So a lot of people will be at different stages with their body after they've had a baby. Some people will be the Amandas of the world. Some people will have, you know, have put on a lot more weight. Hello, 60 pounds if you're me. Do you wait until you have had all of your kids before you look into a new mommy makeover?
It's a great question. I mean, Amanda is the one side of the mommy makeover, what I call the mommy mini, where she's had one child out of a relationship, not sure she's going to get married again or have kids. She's in her mid to late 20s, has a few frustrating changes. She has an operation that takes an hour and 15 minutes, does it on a Thursday, back on a Monday. That's for the mommy minis. Now, if you've had 2 or 3 kids, or you're planning 2 or 3 kids, and there's a lot of changes, loose skin, breast deflation, then you're probably best to wait, because if you have more kids, it may alter your surgery, and that would be more the mommy major, which would be the typical tummy tuck, the body tight type of lipo, and some breast surgery, so some breastwork, lipo, and removal of skin. And usually that mommy major is best to wait until the end of the kids to do that.
Okay, all right. Now, we've got some examples of people who have gone through bigger transformations as well. And these are also mommy makeovers, but these would be more of the major
That would be. So this lady's got a lot of loose skin. Her muscles are weak. She's put on, you know, had 3 or 4 kids. That's really a 3-week recovery. It's a huge change.
Yeah.
And she waited to the end of her childbearing cycle. But there's so many different types of women now in relationships that to force them to wait till they're 40 or 45 means their entire late 20s and 30s may they not feel as sexy as they want to.
Right, so you advise maybe stick with a mini if you're thinking maybe you're going to have a few more kids. So here's another really drastic change here. Same woman.
Yep, a lot of kids, a lot of loose skin, diet and exercise. And again, now she needs the help of plastic surgery to take where diet and exercise got her. She lost a lot of weight, but that's just all loose skin. That's courtesy of 3 or 4 children. The children are great, but they sometimes leave devastation behind them.
Yes, they do. Okay, let's talk a little bit about procedures. There are some that are more invasive than others. What are some of the options out there when it comes to the tummy tucks and the breast augmentations?
So Amanda was on the mini side, and generally with modest loose skin, a little bit of fat, we have products like that Body Tight that you saw moving back and forth. It removes fat and tightens at the same time, but no big incision. And so you could do your procedure on a Thursday, be back to work on a Monday without much downtime.
Okay.
Breast surgery's changed totally. Most women are always afraid, geez, I wonder if I pick the wrong size. With that new Vectra imaging, 3D imaging, it's like going to Holt Renfrew. You see a number of dresses, you think, that's going to look good on me. You try it on and it sucks.
Right.
So you have to try on a bunch of dresses. Now with the implants, it's the same. You can pick a bunch and pick what fits your sense of sexy. She chose a very small implant. It was a 45-minute procedure, and it gave her that little bit of upper pole loss that breastfeeding took away from her, and no amount of diet and exercise is going to bring that back.
So how does that work then, this vector system? Is it just a computer imaging?
Yeah, it's a computer imaging based upon a lot of software data. So we take a bunch of points, the computer does immediately, and based upon a bunch of before and afters can predict very, very quickly what you're going to look like. So it's like watching Dexter season 8, and you have a person's face, you want to know what they're going to look like, you know, a year later or 10 years later. The software will do that for you.
Okay.
It's very cool because it removes the biggest fear.
You can try on boobies.
Yeah,
is what
you can try on breasts, like trying on a dress.
And figure out which ones you want. What are the, if there are any, risks, and who might be the best candidates for this sort of these sort of procedures?
It's very important to remember this is not non-invasive stuff. There are risks, anything from major to minor risks of any surgery. So it's important that the surgeon spends time going over those risks. They're very rare. but someone needs to be prepared to accept the pain and discomfort of surgery.
Yeah.
The mini, you can sort of be back to work feeling uncomfortable in 3 days. With the more mommy major, you know, the tummy tuck, the body tight, the breast work, you really need about 3 weeks off, and that's a big commitment.
Right.
So the risks are acceptable, but they're not negligible or irrelevant. So a good candidate understands the risks and the benefits. They know what they want to achieve. They come in, they get some imaging. We know that their expectations are realistic, and that's the biggest risk, that someone's expectations are here and the outcome's there. I do a good job, they look great, but they wanted to meet Brad Pitt. Well, that may not happen.
Yeah, and I mean, the good thing now is that you have technology to back up what they're going to look like, and I think that really does good in terms of keeping expectations where they should be.
Correct, yes.
Okay.
So.
Dr. Mulholland has brought everyone in today's audience a $250 Spa Medica gift certificate and Vivier Skin Serum 10. So it's an oil-free, medical-grade serum that helps reduce the signs of environmental damage, such as fine lines and wrinkles and uneven skin texture. Thanks so much for that, Steve.
Because breast augmentation has become one of the most popular medical procedures out there. So we decided to follow a mother of 4 as she goes under the knife to get a boob job.
So I packed you guys turkey sandwiches. Every woman who's had children and breastfed can totally relate to this. I guess the term is they sucked me dry almost. I feel depleted, and they're not as perky and firm as they used to be. I had been considering the breast augmentation many years ago after I had my first 2 children.
I don't think she needs the implant.
I don't care.
If she's happy, of course I'll be happy, right?
I'm gonna be late. I don't want to make a huge deal out of it. It's really not a huge deal. We always reinforce self-improvement in our family, whether it's physically or mentally or emotionally. I feel that this is one of those things. Oh, love you. Make smart choices. Yeah, I'm really, really excited. I've been looking forward to this for a very long time.
Very good, thank you. You all set?
I'm here for breast augmentation and a little lift. I'm now 36 double A, and I think I'm going to end up with an ample C/D. So that's gonna be fun.
How are you feeling?
I'm okay, I'm getting excited. It's a fairly major surgery as far as I know. So, but again, it's a risk I'm prepared to take, and I'm looking forward to it. I think I have a very healthy self-image, and I stress that with my kids. You know, that's all. It's all about being healthy and well and vibrant as a human being.
Most patients that I see are women that have tried everything: diet, exercise, healthy living. They look in the mirror and they say, just not me. What's happened? Just turn this way just a bit. Look in the mirror here. You currently have the deflated envelope. We want to give you a little bit of cleavage. Between here and here will be where we put that breast implant in. Pleasant dreams. We'll dream of new blouses and new bathing suit tops and new pajama tops. Their risk of something significant and serious happening is about 1 in 2 million. The medical risks could include death, heart attack, stroke, pulmonary embolus, pneumonia, all the horrible things that can happen from anesthesia. I'm just making an incision now. I want to make this a bloodless pocket, nice and clean, not contaminated. Breast augmentation surgery doesn't go under the muscle, it doesn't go inside the body cavities. It's very well suited to outpatient surgery. After about a week to 10 days, they can get back to relatively normal activity. This is an anatomical implant. If you held this in your hand, eyes closed, you would be hard-pressed to distinguish between a cohesive gel implant and a real breast. So we're going to sit the patient up. Once we sit the patient up, I assess the size, the symmetry, the pocket, make any adjustments in a sitting position, because ultimately that's what most patients care most about, is how they look standing and sitting. That looks very good. Okay, we can put it back down now. Excellent. The scarring generally in this area heals very well. Most patients are extremely happy. It makes a big difference in their life psychologically. And that's why we're physicians, to help people feel better about their existence.
Rosalind, how are you doing? You're just waking up. We're going to take you to recovery.
I'm very happy. I was kind of worried that, you know, they were going to be like massive. The last thing I said to the kids, I actually kissed each of them this morning and sort of gave them a snuggle. They're a little bit worried, but they just want me home again.
I seriously have to start watching these tapes before we take them to air, because Roz is joining us now, who had it done. Thank you, first of all, so much for being here and for being brave enough to do this for us on television.
Thank you very much for having me.
Phenomenal, phenomenal. I have a million questions. Did it hurt? What was the pain factor like?
It was uncomfortable.
Yeah, for how many days?
Percocet does wonders.
Yeah, sure.
So you don't feel much initially.
Dr. Dave says the more drugs, the better.
Yeah,
absolutely.
And I firmly believe in that. But actually, I was on Tramadol after that, after a day or two, because Percocet didn't agree with me too well.
Tramadol is a slightly weaker pain medication.
I mean, how long did it take for you to heal?
I was up and about in about 4 days.
4 days, but you were on your back for 4 days. You were out.
I was getting up and moving around a little bit, but taking it easy. But
you
definitely
wouldn't want to be flat on your back for sure. You want to be up and around.
Right. Yeah. I have so many questions. Like, what was the biggest surprise for you? I mean, what were you expecting versus what you came up with?
I was so thrilled with the results. I really was.
I would be too, my God. Although I have to say, your boobs looked great before. When you took your shirt off in there, I was like, those look good.
I guess it's all perception and what you had before versus after, you know, breastfeeding and the whole thing. So, but I'm absolutely thrilled with the results. And if anything, they've gone down a little. They were quite large to begin with and swollen.
Right.
But I am absolutely thrilled.
And what about sensation? Do you feel
I have total
okay?
sensation. Yeah. Yeah, everything's come back, and it was a little numb and tingly to begin with, just in the skin area, but not a lot of pain in the incision or anything like that.
Are you wearing a bra right now?
Yes, I am.
You are. Why? If I didn't have to, I would never wear a bra again, I swear to God.
The luxury is I don't have to wear a padded bra anymore or anything like that. I don't have to rearrange things inside the bra.
And she wants to fight gravity too, right? I mean, you want the cosmetic result to last as long as possible.
Yeah,
so you might as well hold them in place when you're standing up to keep them from getting pulled down and needing to do it a second time.
Because even with cosmetics, they do pull down ultimately, right?
They have
over
to.
years.
Sure, yeah.
Oh, okay.
Absolutely.
What'd your kids think?
My older son wanted nothing to do with it.
He's how old?
15. So he was kind of like, I don't need to hear about this. That's okay. But I think ultimately all of them are thrilled that I'm thrilled and happy that I'm happy, and we sort of root for each other and are positive and reinforcement and supportive and all that. So
that is awesome. We have actually a before and after shot I'd love to take a look at, even though I kind of saw. Wow. Wow, wow, wow. Anything you do differently in hindsight?
Not at all. I love it. Everything's perfect. It's just as I thought it would be, and more.
Oh, you are a poster woman for this. This is fantastic. Can I ask you? Can I touch them? Do you
Absolutely.
Mind? Okay.
Sure.
I'll do it going to break. When we come back, we're going to have Roz's surgeon, Dr. Stephen Mulholland, come on to talk about boob jobs in general. But let me take it. Feel. Oh my God, they feel fantastic. You want to feel mine? Sure. Welcome back to Doctor in the House. Here to talk to us about breast augmentation is Dr. Stephen Mulholland from, I want to get it right, Spa Medica, right?
Correct.
That's
Thank
your place. Listen, I just felt Roz's breasts. They are spectacular. What did she get put in them?
Well, Roz went for one of the newer forms of implantable devices or breast implants called the cohesive gel, which is a silicone gel. So a lot of women right away go, oh, silicone.
Right, yeah.
So you have to discuss the silicone issue with them. But they're not liquid gel. They're a semi-solid, like your mom's Jell-O. You could cut it and it would stay solid.
Is this one of them in here?
Yeah. This would be the cohesive gel implant. And the gel implant holds its shape, and as you can see, it comes in a nice anatomical teardrop shape, and it's very resilient to change. So as you move, see how it holds its shape, and if you're bending down, bending over, the implant doesn't have many buckles or ripples. And when you feel it, the consistency of the cohesive gel is very, very breast-like.
Let me feel
so
it.
have a feel there.
Yeah, it's pretty good. I have to say, no, I'm serious. I mean, it sounds silly, it looks stupid to say, but it's really cool. Who are the women that are coming to see you for the most part about this?
Well, there are two types of breast implant practices. Mine is more momish. These are women that have had children. They've donated their bodies to reproductive medicine. They've had their kids, and they've breastfed, and they've lactated, and they look in the mirror and they go, oh my gosh, what happened to my breast? It's like air out of a balloon. And so what they're looking for is almost like reconstructive aesthetic surgery. They just want to grab what they once had. They want to get a little bit more femininity, a little sexiness, so they can wear a bathing suit or they can wear an evening gown with no bra, because then they need bras to do all the work and the push-up underwires and the supports. You get all the wrinkles and there's no upper pole or upper breast fullness. And so it's really restoring once they had. The breast implant practice I don't really have. It's the younger woman who's 18, 19, 20, never had breasts and just wants to have some.
Yeah, this is the one I don't get. The women who are in their early 20s and they just want humongous boobs.
Well, the other thing is I was telling you this at a break. We have a girl who comes to the office, 19 years old, 5'10", beautiful hips, beautiful shoulders, A cup, completely disproportionate. Went and got fairly large ones put in because for her size, spectacular result. And she really...
And she's happy.
Well, she's thrilled, and she'll show them to you on a drop of a hat,
So
as we see. But at the end of the day, maybe you could speak to the proportionality of it, because
it's very important, both proportion and age. You mentioned 22. That's important. And I think if someone's 17, 18, 19, it's hard to get to know who you are emotionally and psychologically, let alone having cosmetic surgery. Once you're of voting age and of drinking age, you've had a few years of life, you can make those kinds of... Because this is a lifelong commitment decision to have breast implants. But it's all about proportion, you're right. If you're 5'10", you have big shoulders, big hips, you can carry a bigger breast and still look natural. It's what we're used to in the caricaturization of breast implant is the tiny little waist, the tiny little body, and big D-cup breasts, or the Pamela Anderson syndrome.
Right, even bigger than D-cup. Now, we talked about this is the newest one and the greatest one. What other ones are there still out there?
This is the one that's been on the longest. This has been on the market for over 35 years. This is the Saline Implant. This is salt water inside a silicone baggie, basically. The problem with this, as you can see, is when I let go, it can't hold its shape.
Right, it buckles.
So as women move and bend over, it buckles, and if you're very thin, you'll see those ripples through the skin.
Ew.
And, if you've seen any adult films, which many of your viewers probably haven't, when you see ripples on the side of the skin or corrugations, what you're seeing is the saline implant through the skin.
Because those are older, are they cheaper?
They're much less expensive. That's one thing. If someone says, I'm interested only in safety, they've had almost 40 years on the marketplace. It's salt water, no risk to that, but they will rupture and they will ripple.
Right.
These gel implants are likely very safe. They've been approved both in the United States now and in Canada. Both regulatory bodies, after 10 years of reviewing silicone, do not feel there's a health risk in the long term in any way, shape, or form.
You have different sizes here. What's the most common size that women get?
In Canada, we're much more conservative than the United States. So most women will go from a B cup to a C, or a small C to a big C, but we don't. So the most common implant size in Canada is between 270 cc's, or one measuring cup of water or cohesive gel, to about 300 grams. So generally, a small deflated B cup mom of 2 would go to a full to moderate C, and a lot would then depend on the surgeon's analysis of their hips and their waist ratio, so the breast just gives that nice S-shaped curve.
And I think one of the misconceptions that we should speak to is our word today was mastopexy, what has to do with a lift.
Yes.
Women don't, I think, understand that a lift almost always involves an implant, correct?
Yes. So
you can't just take the muscle here and pull it up.
Well, this implant is one of the newer styles. Again, it's very strong in the bottom end of that implant, and it gives you a bit of a lift effect when you put that implant in. As you can see on the monitor, there's a lift effect. So if they have a moderate degree of droop, and droop is what it's called ptosis, but droop is when you put a pencil under your breast and it stays there.
Yeah.
Now, if you can put the whole Laurentian pack in there, then you may need to remove skin, and that's called a mastopexy.
Okay, I have to ask you really quickly because we're running out of time, but can women breastfeed if they have breast implants?
Good question. So, common questions. Can you breastfeed? What about cancer?
Right.
So, for breastfeeding, about 10% of Canadian women with that sort of B-cup size can't breastfeed anyway, and you go up about 5 or 10% more. So, about 10% increase incidence of not being able to breastfeed just because of the pressure on the gland. So, again, if breastfeeding is very important to you and bonding, wait till after your babies to have augmentation. And then cancer, there's no relationship between an implant and cancer.
Or detecting it.
About 2% of the gland can't be seen on MRI or on CT, but no, for palpating it, no.
All right, guys, we'll have to leave it there. Thank you so much.
Thank you very much.
Fascinating stuff. You're terrific. We love having you here, and we'll be back in a minute. Please stay with us.
Off the top, we're very happy today to have Dr. Steve Mulholland here, and he had a client named Dale. When Dale came to see him, she wanted her pre-baby body back. Can you relate? I can. Let's watch her transformation right now.
Hi, good morning, Dale.
Hi, Dr. Mulholland's ready to see you.
Great.
Okay, so come on back.
Hoping that I can get back the figure that I had before I was pregnant, because I found that after the pregnancy and breastfeeding, I lost all the volume that I had in my breasts. Now they just sag. And then around the middle as well, I feel the skin's really stretched out, and I'd like to be able to tighten up the skin in there a little. But I am working out 3 to 4 times a week, running, doing the sit-ups, the weight training, but it's just not showing in my body overall. I find there's just those certain areas that I'm not getting.
On the tummy, just bend down just a bit. That loose stuff right here is where we're going to do some tightening. We're going to do some subsurfacing or subdermal laser tightening, and we're going to remove a little bit of that skin and tighten that for you. As with many young moms who've had their children, it's not so much about trying to look younger. It's just trying to recapture some of the body they used to have. You expand, contract with pregnancy, and you wake up one day, your kids are off to school, and you look in the mirror and it's like, usually what I recommend is a nice teardrop-shaped cohesive gel implant. And then we do what I call a smart lipo-assisted mini tummy tuck, meaning we only use the C-section scar. We remove a little bit of skin, and we do what's called smart lipo up on the tummy and the hips, which is using a laser to melt the fat and to tighten the skin at the same time. So we get a nice, tighter tummy, very little scar, very little downtime, and a nice breast shape.
So many of us have been in that same situation. And, you know, my answer is after you have a baby, just never bend over and never sit down. And then your stomach is always totally flat.
It's a cheaper solution.
That's a cheaper solution. But your solution works very well. When we see the afters, we're going to see sort of the full effect. How often do you get women in that same situation?
It is probably the most common patient I see. A woman between 27, 28, and 45 to 50, had 1, 2, 3, or 4 children, has devoted her life to reproductive medicine, and now looks in the mirror and wonders where her body went. So it's almost like aesthetic reconstruction. It's trying to recreate or grab onto what one once had, a tight, firm tummy and body, and breasts that match your figure.
Is it ever doable? Like, are we ever really able to get back to that tight tummy without a little bit of help?
We can
happen?
We can get very close to that 25 to 28-year-old figure you had pre-baby. We've got a lot more aesthetic solutions, a lot simpler solutions. It's been an amazing renaissance for the postpartum mom.
Now, for her, she said that she had worked out and everything, but there was always a little something, and she had had a C-section. Does it make a difference, do you think, whether it's a C-section or it's a different sort of birth, a vaginal birth? Does that make a difference in terms of the elasticity in your stomach?
I don't think it makes a difference on the condition of your tummy post-baby. Some of our incision ports or access positions are easier with C-section, but whether it's normal vaginal or C-section, the common complaints are loose skin, stretch marks, no muscle tone, and this pot, this bulge with a little bit of fat and loose skin you can't exercise away, or breasts that have just deflated in front of your eyes, and so you wear an evening gown and there's always that little wrinkling and no fullness up top, or you wear an underwire push-up and there's nothing to push up, or you just want to wear a tank top with nothing on underneath and there's nothing there.
Are you kidding me? With nothing on underneath?
Absolutely.
Yeah, those days are over for me, my friend. I remember them, though. So what I found interesting about that tape is that you said you actually go through the C-section incision. So,
you know, the common points that we go in to do this smart lipo or tummy tightening with lasers and probes, the belly button, through pubic hair, through C-section scars, so very unobtrusive. Certainly more so than it used to be with the big tummy tuck scars.
Right.
The breast implants, we're going to talk about that later, but there's many stealth ways to go in and bring back that volume.
Excellent. Well, you did a really, really good job. So Dale, as we mentioned, wanted to restore her body to her pre-baby look. Let's take a look at the results.
Dale, it's so good to see you. How are you? I was just looking at your pictures and admiring your post-op outcome. Come on in. Let's have a look at them. So Dale, it's 8 weeks after your surgery. What do you think?
I love it. I think it's great. I couldn't be happier. And yeah, I'm no complaints at all.
If you look at the pre's, you can see it was difficult for you to fill a bathing suit.
Definitely,
and we've got a nice little post picture here. It looks like a natural breast.
Yeah.
It doesn't look
definitely.
fake.
I feel great right now. Honestly, though, I think for the first couple weeks before surgery, I was on an emotional roller coaster. Of course, I was usually excited and couldn't wait to have the surgery done. But there's also a lot of times when I was feeling really anxious, very nervous, and almost getting cold feet at some points, mainly because I'd never had surgery before, and I didn't know what to expect. I was worried about what the results were going to look like, but also worried about the recovery, worried about any possible complications. But now, 2 months later, I am so glad I had the surgery done. This body makeover was probably one of the best things I could have done for myself. I love the results. I think that Dr. Mulholland exceeded my expectations. I had hoped to regain back the fullness that I had before pregnancy, and I think my body's even better than it was before I was pregnant. I love it. I had my 40th birthday this summer, and I think I look better than I did in my 20s.
Now that's good work. She feels better than she did before the baby. That's amazing. So you've got some befores and afters here.
Yeah, I think this really highlights and will resonate with any woman that's had children. You know, you that bent over and it's kind of a little loose.
Yeah.
That's very easy to fix now. So, under local anesthetic, that's the other thing. You don't need a general. You don't need to stay overnight. It's very quick, relatively painless. This little post-mummy tummy, usually below the belly button or the little wrinkles above, and when you bend over, it's loose. It's just not as sexy as it once was. So as you said, you never bend over and you never sit down.
Sit down, like I am right now.
This is her bent over view after. You see it's nice and tight, more pre-babyish. And you know, I think having children is great. Sometimes it ravages the body, and we should take pride in being moms and dads. But you don't have to live with the consequences of childbirth anymore if you don't want to.
Well, the other thing is you're going through so much hormonally as well. It's really tough to get used to your new body. So it's nice if there is something that can help you sort of get back to the way you were, the way you liked your body. How long did she wait? Like after she gave birth?
Yeah, she was about 4 or 5 years after. I mean, she worked out and dieted, hoping, as many women do, I can do this. I can exercise through my loose skin, stretch marks, and that little roll. And so I never advocate doing any kind of procedure within a year of breastfeeding. Not just childbirth, but finish the breastfeeding, because that estrogen and progesterone has an effect on your skin. Right. So that all the dust settle, that everything just deflate, droop, and sag. Try your best in the gym, and some people do. They have surprising genetic code, and their skin looks great after children, but some don't. And so wait a year, see a cosmetic plastic surgeon you feel comfortable with, who offers you minimal invasive and options in restoration. So 1 year.
How long for recovery for her? Or in general?
You're up and walking that day nowadays. You're up and moving that day. Nothing heavy lifting for 3 weeks, but you're back to your normal lifestyle within a month.
All right, you have brought down a fantastic gift for everyone in the audience. I think you're really going to like this. Dr. Mulholland has brought down a $100 coupon and some Spa Medica skincare products for everyone in the audience. So if you wanted to, you could go and get one of the non-invasive procedures, put this towards anything you want. Thank you so much. That was a really good lesson.